So I do these sorts of things first, right? Pure rotation, less extreme side bending, and less cranking.
I can see that.
How's that?
Even that might be.
Because lots of times those diaphragms are stuck up anyways, right?
Yeah.
So this is really, you know, where I might start with it. There's so much stuff with COPD people that, I mean, you want to make sure you've treated the sympathetic chain ganglion in the third chakra, right?
Well,
that's the place you have to
pretty much
start.
all we can, yeah.
I mean, depending upon who it is and where they are, I mean, it's a sympathetic chain, the sympathetic hyperreactivity and the imbalance that's keeping the bronchioles, like somebody with more acute reactive airway disease, it's all sympathetic nervous system, right? If you think about it. So the sympathetic chain ganglia and balancing sympathetic way more than you normally would if you're treating. And you may have an extra pillow lift up here under their upper, okay? That's all. Can I have another pillow? Lift up there. This goes up there. How's that? So, Jane and Catherine, you get the 12th ribs, please?
Oh, for COPD?
Yep. Cindy, will you get under the sympathetic chain ganglia?
Here.
Yep, just 12th ribs.
Two of us. You get two of us out of a damn chair.
From one nurse to another.
Yeah.
Shit. There's no honor among sisters. I'm not filming you.
Tomorrow, as long as you're there, third chakra.
Can? Okay.
Pammy?
Oh, gosh. That's
We're going to take the psoas muscles into their shortened position.
Yeah, both sides.
Both sides.
Yeah. Okay. I'm not going to film this.
What I like to do, because look, as soon as she does that and hyperextended her neck, which she's not going to like, come under the pillow.
Okay. Both of them? Or
Just that one. So lift up there.
okay.
Come under
I'm
the
there.
pillow.
I'm there.
Good.
Oh, much
See,
better.
so now the pillow's resting on her forearm.
much better.
Yeah, got to do it that way.
Yeah.
Great.
Right.
Thank you.
Imagine you're having a hard time breathing. That will support you. That isn't going to do it. Right? And what we're going to do, what does the psoas muscle look like when it's shortened and relaxed? Well, it's a flexor.
Flex.
Is it not?
Yeah.
Up to slower. Sorry. Let's find our point of maximum softness. And now, because it attaches to the lesser trochanter inside here, the closer we go into flexion, and it's pulling, the more it pulls the thigh into external rotation. So this is, yeah, here we are. And you feel it breathe? It just goes, ah.
Can you feel it relax in the back? Yeah.
And they got the 12 ribs, so we're done.
Yeah, essentially that's it.
So for
I want that
children who
treatment.
have progressive lung diseases, keeping these things flexible
Yes.
would be very...
Yes. So look at
You know how to do that.
look at what we're introducing plasticity-wise, right? Look at what we're doing. We're helping her with an autonomic nervous system plasticity by working with third chakra sympathetic chain ganglia, right? So nervous system plasticity, diaphragmatic, right, plasticity, and psoas, accessory muscle plasticity. And if Jane were alone, she could relinquish this hand,
Right.
come under here, and do this herself.
One side here.
Where you kind of want to get your forearm, other way around. Your palm on her thigh, your elbow kind of supports there.
Like that.
That's it.
Is that comfortable?
Then we need to support
That's it.
Pretty comfortable?
So, because I use my upper arm,
Yeah.
I use my upper arm to,
Okay,
yeah,
like
exactly.
this. Okay, better.
If I'm sitting, I have them on my shoulder.
Yeah, this is
Right.
better for me. Yeah,
Yeah.
it also feels more comfortable for you. So just, again,
Right.
relax.
See how I've got her in balance now? Right? Now I want you to drop your head forward. Now, where does the pretracheal fascia go?
Under the notochord.
Okay, it starts under the notochord on the top. Where does it go?
It goes up and around the head.
Oh, in
Curls
front of the
around,
spine.
Doesn't it? Pretracheal? Oh,
Pretracheal fascia.
In front of the trachea.
Where does it end up?
Oh, we're saying
Diaphragm.
Good. central tendon to diaphragm, right? So it's a fascial column that runs from the tip of the notochord under the tip of the notochord up inside the pharynx, up there, right? Runs down the throat, runs down the chest, runs down the mediastinum, right? This is, it's part of what's going on with the pericardium, and then ends up in the diaphragm, central tendon. It follows the course of upper coil. Right? Oh. So drop your head and slouch. Okay. My thumbs are going to drop down behind her ribs, and I'm going to start following the tension. Can you see? Yeah, you can see. Just kind of keep in there.
Can't see.
Come on in under here, Melinda.
You're in R1?
What's that?
Are you in the first rib? Underneath.
Did I mention ribs? No. So if
no,
I didn't mention ribs, I have nothing to do. I'm working the fascial column, the pretracheal fascia.
Oh.
I'm behind her clavicles, slipping into the lung space, into the chest cavity. Big breath in.
Behind her. So you're on the top lung.
I'm at the apex of the lung. But now I'm slipping in front of the lung. Inhale, exhale, drop down. Yeah.
Wow,
See me
that's amazing.
dropping down
Yes.
behind the clavicle as she releases. I mean, she's not used to having anybody's thumbs in there. But big breath in, start to sit up, head up. I'm holding what I've got. I'm not letting it come up. And then exhale and breathe down. Drop everything down. There I go. Now, when I finally feel like I've gotten enough release going down, I'm following the tension of the fascia down. Toward where? Central tendon to diaphragm, right? When I feel it breathe and kind of spring back up, right? Because I've been pushing it down, pushing it down, pushing it down. Now what's going to happen is when I have her sit up, I need to lift it. So, take a big breath in, head up, hold it up. See, I'm lifting it up and out. Drop your arms down. And out. Good. You good in there?
Did you actually physically lift?
Yeah.
Wow. And your thumbs were there.
Yeah, I'm on the either side. Here are the tendons of the sternocleidomastoidea. See them? Right here. And my thumbs are on the clavicle, right lateral to it, where I could drop down in. So if you dropped your head, see how so I'm dropping down toward the central tendon of the diaphragm, and I'm releasing that fascia down into the mediastinum, all the way down until I feel the connection to the central tendon. When I feel that release and breathe open is when now, remember we did the patient turns the nut, we hold the nut and the patient turns the bolt, right? So what's happening now is we've turned the nut, 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 right? And then when she sits up, we're actually turning the nut and the bolt with her, right? It's not always that comfortable while you're doing it. When they finally release into it, it's kind of pleasant, at the moment where, just before I lifted. But the lift is usually, it's a lot. This whole area of the bow tie is hugely infested with stretch and pain receptors. So it's not pleasant to do work anywhere along.
So when you're lifting, you're kind of squeezing it? So
No, I'm not squeezing. I'm holding what I've got, and I'm just lifting up like that.
Okay.
Obviously, I have to have enough contact pressure so I'm not sliding up. But once you've been inside and you're there, there's not a lot to just lift the fascia, right?